Hello, my name is Jillian Lalonde from Toronto, Canada. I'm a speech-language pathologist and listening and spoken language specialist, auditory verbal therapist candidate from Luminous Community Services, one of the partner agencies of Early Abilities and the Toronto Infant Hearing Program. This poster was co-created with Maria Amelia de Mello, a speech-language pathologist, audiologist, and certified listening and spoken language specialist, auditory verbal therapist from Early Abilities and Toronto Public Health. Our poster describes the Virtual Here to Talk program, a family-centered service for children newly identified with unilateral or bilateral mild or moderate permanent hearing loss in the better ear, and whose parents have chosen a listening and spoken language approach for their child. There are a number of studies that indicate that this group of children commonly receive limited early intervention services and are more susceptible to experiencing difficulties in their language, academic, and psychosocial skills. Virtual Here to Talk promotes collaborative practice among all members of the child's team and takes a preventative approach to early intervention by providing appropriate and timely services to an at-risk population. It was created at the request of parents to meet with a speech-language pathologist shortly after their child's hearing loss was identified, and was also created in conjunction with parents who were an integral part of the program's design. The initiative was also developed to ensure the Toronto Infant Hearing Program meets two of the essential predictors that research indicates has a significant impact on a child's spoken language development: early intervention no later than 6 months, and the active involvement and participation of parents. This poster briefly describes the Virtual Here to Talk program, which is easily transferable to other EDI programs worldwide. The highlights of a parental online survey and an analysis of the impact of an early intervention program on parental self-efficacy will also be discussed. Here to Talk began as an in-person service in November 2019 and transitioned to a virtual model in March 2020. As primary facilitators of maximizing their child's spoken language potential, parents are the main client. 2 appointments are provided by a speech-language pathologist, an initial and follow-up assessment. For more detailed information about the topics addressed in each appointment, please download the PDF. An online survey was sent to parents after the initial and follow-up assessments. Data from March 2020 to January 2022 was analyzed with a focus on descriptive statistics and qualitative methods. Among the preliminary results, there are some highlights. The Virtual Here to Talk initial assessment met the Joint Committee on Infant Hearing's recommendation for providing early intervention to children with permanent hearing loss by 6 months. The majority of parents would recommend Virtual Here to Talk to others and stated that it helped them support their child. These findings are in agreement with publications that promote increasing parental self-efficacy skills as they improve communication outcomes. This concept can also be observed in the parental testimonials from the survey. What parents said they liked about virtual appointments: accessibility, could log on from home and receive face-to-face support. How the service has helped parents to support their child. It has given us a roadmap of what we need to support our child in her development. What parents said they learned: the importance of having the support and strategies to help my baby in this journey. And what parents liked most: I got some confidence and motivation. Not only are we taught how to better help our child with their hearing loss, but also how to maintain it, and most of all, to understand the importance of wearing the hearing aid. In conclusion, preliminary results indicate a significant growth of parental knowledge, skills, and confidence following participation in Virtual Here to Talk shortly after hearing loss identification. Future studies should ensure that surveys are also provided to parents prior to Virtual Here to Talk, and that all surveys are completed by the same individual in order to more accurately compare parental insights and progression of expertise over time. Additionally, the implementation of a hybrid Virtual Here to Talk model and professionals' perspectives regarding the benefits and challenges of providing virtual early intervention and Virtual Here to Talk's impact on facilitating collaborative practice among team members should also be explored.